Whenever you went to a doctor, did the doctor told you what you had?
Yeah.
Did they do a biopsy?
No, not a biopsy.
They automatically just told you what you had,
Uh huh.
and what was that?
Just like different points like alopecia totalis, alopecia universalis, and then there's just been different phases of growth.
Mm-hmm.
So it like alters every now and then.
Did they tell you that your alopecia is chronic or no?
Um, no, I don't think chronic is terminology used within the uh, the use of alopecia. It's just autoimmune.
Mm-hmm. So essentially, what it is when you um when you have alopecia areata,
Mm-hmm.
alopecia it starts with alopecia areata, and that's it.
Mm-hmm.
It gets severe where it looks, totalis or
Mm-hmm.
universalis.
Mm-hmm.
There's a difference between them two.
Mm-hmm.
I can think of. There's one that like I feel like totalis is the one that
That's just the
correct me if I'm wrong, but it's the one that like you won't grow anything in your not even eyebrows.
no. That's
That's
universalis.
universal. Okay,
Uh,
correct. Okay,
totalis
perfect.
is just
It's just
the
the hair.
head.
Okay, perfect. Yeah,
And
you usually get
areata is just patchy.
is patchy,
Uh,
correct. So so then what happens is that with the biopsy,
mm-hmm.
you could they could tell you if your hair will grow back or not. If
Yeah,
they
I thought about having one.
yeah.
Uh,
It'll pretty much tell you if your alopecia is chronic.
okay.
And that what that means is that if it's chronic, that means that there is no treatment that could help you. Just SMP, which which is what we're doing right now.
Mm-hmm.
But yeah, I usually like you're one of my probably in the past 10, 11 years that I've been doing SMP, you're like
Mm-hmm.
this probably the patient number 5
Okay.
that I've done with this case.
I just don't know how much to put into biopsies and things of that nature. Because I've seen things like where people have no body hair for decades, like 30 years, and then they get on like a jack inhibitor, and then
Mm-hmm.
they grow everything back, and after being told nothing's gonna come back. So you
So
know,
the thing is, I mean, it's just it's an exam just to kind of um get a response or get just
mm-hmm,
to, so you will know what you have.
mm-hmm,
That way you don't feel like there's hope.
mm-hmm.
Um, my thing of it is like if you had this condition for over more than 5 years and it hasn't changed the hair pattern,
Mm-hmm.
essentially it's gonna be kind of hard to recover from that. Um,
Yeah, mine is definitely morphed over 5 years.
more than five
Yeah,
years,
it's
yeah. So
no,
then,
not been there over more than 5 years, but it's changed.
yeah,
Like
it's
it,
changed the pattern over 5 years.
yeah, yeah, it's just unpredictable.
And I mean, you haven't seen any changes since we started doing SMP, right?
I think I see growth coming in because I'm taking different things,
Okay.
and I'm
Because
gonna
this triggers hair growth.
the circulation as well. And another thing I'm gonna do is alter my diet as well. That plays a factor also.
Mm-hmm.
Food allergies, inflammation.
Yeah.
So that's another aspect I haven't really dived too deep into.
And you've done your research really thorough.
Oh yeah, I read like medical PDFs and all that.
Really.
Yeah.
Yeah, that's why I couldn't really tell whether it was totalis or universalis,
Yeah,
but it's
at
because
this
like
yeah.
the last client I've done was like
hmm
2 years ago.
Yeah, this stage is just areatas, patchy. But
Mm-hmm.
I've been universalis where nothing was like I had no eyebrows, nothing.
Mm-hmm.
So it just keeps
So
morphing.
the treatment has actually helped you.
Oh yeah, yeah, definitely.
That's good.
Uh-huh. I like I said, I plan on everything coming back, but just
Mm-hmm.
I'm doing this for density in the meantime. So in the
That's good.
between.
So I the last client I had, he actually drove from Atlanta.
Mm.
Yeah. and he had cold feet.
Mm.
He was in the parking lot here, and he was literally about to drive back. And if it wasn't because I reach out, because I saw him from my window, and I was like, "Hey, how you doing? Everything okay?" And that's how he like was willing to come in. And he told me that the day of. He said, "Yeah, I had cold feet. I was about to drive back around."
Wow,
And
man.
towards the end, he was like, "Man, I would have made the wrong choice if I would have left." Because after the procedure was done, like, yeah, he was really happy. He was really thrilled.
And you did his entirely in one day?
No, 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 no.
Okay.
He had to come back multiple times.
Okay.
I do a 1 day, like 2 sessions in 1 day, whenever I have people coming from far away, far, far, far.
Mm-hmm.
But if it's a special case, because this is important. Like, you've dealt with so much going on like that.
Mm-hmm.
I want to make sure, and I want to take precautions.
Mm-hmm.
If it's your cases like yours, but if it's just like a normal male or female pattern baldness,
Something you can knock out quicker.
I could take the risk because um, we're not dealing with any type of immune disease or any
Mm-hmm.
type of skin texture that's
Mm-hmm.
different than this is the unique
Right.
case that we have to take precautions
Right.
because everything changed.
Right.
The texture of your scalp, everything.
Mm-hmm. I appreciate the carefulness.
Yeah, of course. And to me, if it fades more than what I wanted, it's good because that means that I can go back and I know how to tackle it.
Mm-hmm.
I'd rather take my time.
Mm-hmm. Makes sense.
Yeah, but I mean, little by little, like we're start noticing a lot more density. Start noticing a lot. It's getting more closer to the finish line,
Mm-hmm.
and pretty happy with the how it's turning.
Yes. Good.
How old were you when this started?
Like before high school, so like right before, so I say like 11.
Ninth grade.
No, it was in elementary. I'd say like maybe 10, 11 ish. I think 11.
I know this might be a personal question, but
Mm-hmm.
did you have a like how was your childhood at the time?
It was stressful.
Really?
Yeah, I think that played a part, but there's just so many different avenues, like the food avenue. I want to get full allergy panel done to see different things that could be. I think tomatoes right now are one of the things that might be.
I needed a cut on tomatoes myself because it
Uh-huh.
gave me heartburn.
Yeah, right. Yeah, same for me. And one of the things I eat a lot is pizza, so I just make little connections like that. But I need to get it confirmed by
Well, yeah,
yeah, nutritionist.
that's really important actually.
Hmm.
Every year you should supposed to do a blood work to check your vitamin deficiency levels.
Yeah, I pay out of pocket for a lot of different things.
Me too.
I don't have insurance.
Yeah, yeah. Insurance is outrageous right now.
Yeah.
You know what's crazy?
Hmm.
I was doing SMP on one of my clients who's a dentist. He just graduated from
Oh
school.
wow. Uh-huh.
And he goes and he said it's cheaper to not having dental insurance. It's cheaper to pay out of pocket.
You would know.
Yeah, he told me, yeah, it's not worth it.
Yeah.
I was just like, whoa. Coming from a dentist, you know what I mean?
Uh-huh.
Like right after I finished, I told my wife to cancel my dental insurance. And it's true though. Like if you don't have insurance, you go into any clinic and they'll like, oh yeah, they'll have the specials for you and stuff.
Yeah, the part that I like is just the availability is always quicker for you
Mm-hmm.
as opposed to stuff, having to wait for clearances to,
Mm-hmm.
months down the line.
Yeah. No pain, right?
No pain.
That's crazy. That cream works
Mm-hmm.
really good.
It does. I don't think I feel anything really either way, but I'm sure it helps.
Yeah. Last time, how long it took us? Like what? 4 hours? 3 hours?
Uh, I just know it's dark whenever I leave.
Yeah. Yeah, about 4 hours, I would say.
I think I left in the 6 o'clock hour sometime.
Mm-hmm. So whenever you did your research, did you check all of my previous work online on
Yeah,
Instagram?
yeah. I found you on Reddit, and then looked through a lot of the things you were posting, and then went to your Instagram.
Oh, nice.
Uh-huh.
Man,
Did you
Reddit
check?
right now,
Mm-hmm.
I did a controversy. So I posted a video. I'm sorry. I posted a picture of a guy with a defined hairline, and in that post in that group, they do not like defined hairlines. So I've been getting a lot of people like talking really bad about it.
Defined as in like the real straight, like
Yeah.
lines that we talk about, like the
Mm-hmm. Well,
helmet
no,
kind
no,
of
no.
stuff.
Like the one I'm doing on you right now.
Oh, okay.
So everybody hates that.
So
In that group, I'm not saying that it's a bad work or anything. It's just in that group, everybody just wanna post natural hairline.
hmm
So there's a lot of trolls on there. So I did it just to just to do a controversy because there are people that are wanting to do this type of hairline that I'm doing on you, right?
hmm
And they end up not getting it done because all they see is like natural hairlines. But it's like, yeah, but what if you want to go to a barber and want to get a defined hairline or something, you know? You can still do it. It's still gonna look natural.
But would you say that what you're doing on me is the more natural of the defined?
Yeah, more realistic
Uh huh.
because it's natural is natural and for me. What it means is without doing any type of haircut.
hmm
You know what does a natural hairline look like?
hmm
You let your hair grow,
hmm
or you cut your hair maybe at a one guard without even touching the hairline or shaping up your hairline.
hmm
The way how it looks, that's the natural hairline.
hmm
But once you already create your hairline with the trimmers or shaping it up,
hmm
you're actually making it as realistic as possible.
hmm
So that's the difference, and people in there doesn't understand the difference.
Yeah,
They
I want it to look low and but somewhat defined, but just not like some of the stuff that we've seen before. That's just like dark and totally
right,
straight,
right,
and
right, right. So yours is more. It's gonna look like you grab a pair of trimmers
hmm
and you shape yourself up.
hmm
You know, it's not gonna look painted. It's not gonna look. You know, it's
Yeah,
not
I
gonna
don't want
look.
to look into too hard to describe. I just want it looking low and just natural to where my hairline would be.
Well, in your case, the picture you show me, it's more realistic.
hmm
Defined hairline.
hmm
Natural is like that you didn't do anything in your hairline, and
hmm
that's how your natural hair grows.
hmm
Because not everybody has you know a sharp edge up or a
hmm
defined hairline.
Right.
Defined hairlines are pretty much made by a barber or by the person that's cutting your hair.
hmm
So those are two different things.
Right.
Is it gonna look? Is it gonna look like you had a haircut? Yeah. Is it gonna look like you went to a barber? Is it gonna look like you had SMP? It's not gonna look like you had SMP
hmm
because it's not gonna look obvious.
Right.
The picture you showed me that you wanted, that's actually like a lot more defined
hmm
than what I'm doing. We can make it that defined, but I will make that, I would actually do that at the end on the last session in case you want it
You're
sharper.
doing things to where there could still be adjustments.
Exactly. Where you can, because you haven't seen your hairline in a while.
hmm
So what I like to do is to go conservative, even then,
hmm
where that if you wanted to break it, you can break it. If you wanted to um, more sharper, you can do it too.
And
I
also,
always leave that towards the end.
yeah, I'm also coming from a standpoint of just I know there's one other drug that I'm gonna start taking that probably is gonna bring everything back. It's a different jack inhibitor as well, so it look different if that actually
Help.
yeah, if my actual hair starts turn off on yeah, if that starts coming in over what you're doing, it'll obviously look
It's gonna make it darker
yeah.
and
So
more realistic too, because you're gonna have volume now
uh-huh.
if it goes back.
Yeah.
There's a doctor that I follow that's from New York, and
Uh-huh.
he's actually has the same condition as you. He has universalis.
Okay.
And he does transplants.
Oh
He has a joke that says, "I give all my hair to all my patients."
wow. That's funny.
Yeah. Did you play video games where you were a kid?
When I was younger, but um, pretty much stopped sometime in my certainly before 18, so sometime in my teens, and just more focused on I guess real world things.
What did you think it? What kind of stress caused you while you were losing your hair? Was it
Familial,
family,
yeah, yeah, somewhat.
divorce?
Moving around, just unhealthy parental um, dynamic,
Mm.
just a lot of stuff carried into my adulthood.
Do you still feel like it's affecting you?
Yeah, definitely. It's like I'm the youngest of five, and
Mm.
just the role that I have in my family, it feels like I'm the eldest. Certainly with my brothers, um, I do all the stuff for my mom. I have a brother down here, but all the weight's on me, and
Mm.
he's just in his own world. I'm trying to focus on
On you.
my stock market endeavor, and then moving where my girlfriend is. But my mom has all this health stuff going on, so I have to, like yesterday, I had to tend to helping her out. She doesn't really, she's not so accommodating to my
Mm.
mission of what I have to do.
I mean, don't we all have trauma from childhood
Hmm.
that we now dealing with?
Yeah, most people.
Yeah. One thing is that once we get to a certain age,
Hmm.
we can blame it on the childhood. We can blame it on ourselves
Right.
because we let that carry us to our daily life, you know.
Right.
And I think that it's important to do therapy.
Hmm.
And
Yeah, I don't think about the childhood stuff. I just thought about it now because you asked me, but um, I try to just block it out. It's there, but just try to put it in the
just
back of my head.
acknowledge what you've lived,
Hmm.
because if you block it, that's also bad. Because your
Yeah.
body can also like, you can get into a certain moment in your life that you will actually look back and look at yourself inside of you,
Hmm.
and your soul would just pretty much break down
Hmm.
a lot faster.
Hmm.
I'm telling you because that shit happened to me. And so it's something that, just acknowledge that it's there, but not let it consume or not let it bother you.
Yeah,
And
definitely
just
can't let it consume you.
and that's how you're able to pretty much, um, you would say, surpass that.
Hmm.
Um, I believe with the SMP that you're doing, it's definitely gonna give your confidence back, and I think that it's gonna help you too emotionally.
Hmm.
Cause I'm gonna be honest with you, like this is what this done to me.
Hmm.
It definitely changed my whole
Did you
lifestyle.
perform your own SMP?
No. So I had my first session a while back, about 12 years ago.
Hmm.
I had it done in first session. I had it done in Colombia, but the person who did it was like, he didn't do a good job on my second session.
Mm.
That I had to get it removed.
Mm. That's not good.
I tried to fix it, but it didn't work out.
Hmm.
When I removed it, I redid it again. That's when I'm like, oof, this is the way to go.
Right.
Um, and I did it on my beard. I did it in,
Hmm.
I've already done a couple of touch-ups.
Hmm.
So I'm pretty happy with the results now.
Hmm.
And I even back then, where whenever I did it, and whenever I found out that my procedure wasn't like the best,
Hmm.
even then, like, it did change my, it did give me the boost that I needed.
Hmm.
However, like, if you look at detail work, yeah, you could see some of the detail that could have been better.
Mm-hmm.
But overall, like I was still, I looked better. I looked. Nobody could tell that I had a bad work.
Mm-hmm.
It was just minor details that I personally, now that with the quality and the expertise that I have,
Right.
I wouldn't be walking around with what I had.
Right. You looking closely in the mirror every day.
Yeah.
The angles that.
Not my front, but the back, the crown area.
Okay.
And it was kind of my fault too, because I didn't want to shave. I wanted to keep my hair long. So the person, he just tried to cover that area. So whenever I shave, that's when you see the details.
Right.
So that's essentially what happened. It wasn't like it was a bad procedure. It was just like two different scenarios, two different hairstyles that I was trying to do. That it was either one or the other.
The SMP had to be more accommodating to a shorter look.
To a shorter look instead of a longer hair look.
Right.
So that's when the mistake was. But other than that, I mean, I felt great. I mean, it changed my life, to be honest. I mean, ultimately, a lot of people are like pretty skeptical about it, and they think that, oh yeah, it's gonna do this and that, thinking that it's a tattoo, but they don't realize that the only thing that we have closer to a tattoo is the needle that we use and the fact that we're penetrating pigment into the scalp. But other than that, as far as the depth, as far as the technique, as far as everything else, the pigment color, neutralizing and all that, like it's different.
I think it's a lot more intricate than just a standard tattoo.
Exactly. Even though there's artists that do puntillism art, but even then, like, the art still is a bit different. I actually admire the tattoo art now. Before, I grew up in a really conservative family where people would be like, with my family, be like, hey, if you get a tattoo, you're never gonna get a job. You're not gonna be successful. So that was the mentality that I had growing up. But now that I'm older and how society has changed and how everything has changed, you tend to like certain things that before you thought that it wasn't like a tattoo. I don't have tattoos myself, but I do just admire the art.
Yeah, I think there's different connotations to them now in the 2020s opposed to previous decades. In workplaces and whatnot.
Yeah.
Corporate America.
And you live here in Greensboro, right?
No, I live in Raleigh.
You live in Raleigh? What?
Yeah.
I thought you were from this area.
No, I told you. I said this is a long. I told you initially how long of a drive it is.
Mom, I'm sorry.
No, that's good.
I see a lot of people, man, and I get to know my clients like on the second, third session.
I'm sure that you hear a lot of different drive times and stuff, so it's hard.
Yeah, but Raleigh, that's amazing because over there is quite a bit of people, that does this.
Yeah,
Have you gone like to consultations in other places before
No,
you?
no, no. You're the only person that I targeted out just from seeing your work and whatnot.
Nice,
Yeah,
thank you. But that's amazing. Appreciate you, trusting in me and
yeah. So like this is always like an afternoon that I dedicate have to dedicate for these. So that's why I chose 2 p.m. as opposed to 9 a.m. So I can at least
do your tradings
yeah,
and do your okay.
yeah. That's why I set it up like that. By the time I get back, it's always just the end of the day.
And one thing that I also want to say and mention is like I appreciate your patience too, though, because you're coming in here for this is the third time,
Hmm.
and having patience to actually see the final result, especially in your case, it's
Oh yeah, no rush for you know getting things done the right
right
way.
away, yeah.
Some people want to see the finished product, in the first
And
session
and
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 stuff.
that's the thing, like when it comes to some of those folks that they want things to be done right away. Yeah, you see results, but surprising the ones that like ask for discounts, the ones that like pretty they want pretty much more and want to pay less.
Hmm.
Those are the ones that like pretty be. Those are the ones that doesn't trust the process.
Hmm.
And it's funny how it works. Um, the more picky, the more that they don't trust the process. They don't trust the artist.
Hmm.
But the ones that do trust you, do trust the brand, do trust the process, and have seen multiple procedures from other clients,
Hmm.
the sessions tends to go a lot more easy
Hmm.
going because you could feel the energy from your clients too.
Hmm. Absolutely.
Yeah, but
I'm sure you get people who try to think that they know more about everything than you do, and then you're the
yeah,
one who's behind.
and they trust
Yeah.
more ChatGPT. It used to be Google, but now it's ChatGPT.
Yeah, I find a lot of I do like different queries just sometimes, and then I see a lot of errors.
Mm-hmm.
AI isn't as accurate as a lot of people make it out to be.
Yeah. But hey, if you were to, I want to see how it looks when once with the new medication that you're trying to do to regain your hair,
Hmm.
because your condition is very unique. Have you looked into how many people in the population tends to get this condition?
Yeah, it's like 2%.
2% of the population in the U.S.
Yeah, or just world, just in general.
worldwide.
Yeah.
Yeah, because I mean I've been doing hair for like 11 to 12 years now,
Mhm.
and I've seen about five to six of your cases
Mhm.
that I've helped.
Mhm.
There's a guy that he came back for touch-ups
Mhm.
afterwards, and he's actually writing a book. I think
Mhm.
he should be done by now, but
Mhm.
I did his session like a couple months ago.
Okay.
But you build, I build relationship with people afterwards, and it's amazing how SMP can definitely
Mhm. Connecting.
connect with people. Yeah.
I'm definitely anticipating it coming back. It's just doing different things that I haven't tried yet.
I mean, you definitely have the options to do that, and
Mhm.
I mean, we all want to grow hair,
Mhm.
and that's one of the reasons some clients that wants to grow hair goes and do things that are not that they're not a candidate to,
Mhm.
and just because they get stuck in their head that you're like, hey, if it works with if this worked with somebody else, it's gonna work with me.
Mhm.
And understanding the procedure and the process, that's another thing.
Mhm. Right.
And, like to be very transparent and let them know that hey, hair transplant doesn't work, or
Right.
SMP doesn't work according to what you're looking for.
People can be more of a candidate to different things, different points in their life, as well as just what point you're seeing them at.
Exactly. Three things that you have to look for. One, what is your expectations? Two, um, what's the pros and cons of the solution that you're doing? What are the side effects? And then three, can I afford this?
Right.
That's what's gonna make him or break a client or a patient wanting to do a procedure.
Yeah, for a lot of people, it's price point alone before there's even other things.
Oh yeah, a lot of people do. They call it shop around, and a lot of times, I mean, you get what you pay for.
Yeah.
Instead of looking for the quality,
Yeah.
instead of looking for, like my procedures, like I'll always offer a warranty, right? And a lot of people that does this do not offer a warranty.
Right.
But they end up spending more money because it's more. It sounds a lot more. They would say like the price is more sweeter when you hear a lower price and without knowing what you're getting. And
Yeah. I've seen some people say that their SMP is like in the like $300 range, and
oh, that's a red flag.
yeah, I'm like, I don't.
That's a red
Yeah.
flag. And they say,
I don't
yeah,
know.
I can go to Turkey or I can go to Mexico or I can go to Florida and get it cheaper. And there's always like that.
Yeah.
But unfortunately, I always tell people, man, don't put a price on your image because your image is important, Like,
Yeah, there's certain things you bargain with.
exactly.
Not,
Obviously, you're gonna fall into people that don't do the research thoroughly. They might fall into the wrong hands. And I think the majority of people don't really do the research accordingly, or not want to take their time to sit down and talk. They just
or
want to go with
there's this headset on just finding just whatever's the cheapest.
yeah, and then they settle with that. Or also people that settle with the location too, like, oh, you're too far from me.
Right, that as well.
You're too far from me. It's only 2 hours. It's 2 hours too far from me. You don't have anything closer to me, and I'm like, nope. If you look at what we do versus what they do in your town, like I'm pretty sure you're gonna want to make the drive. Have you been to Greensboro before? Who would think that you would be end up here getting your SMP in Greensboro?
It's my first time coming out here.
Really?
Yeah. Do you live here?
I actually live midway from you.
Oh, in the middle.
Yeah,
Okay.
Burlington.
Oh, okay. Yeah, I passed through there. Yeah.
My exit is Target exit.
Yeah, I never thought I'd be coming out here.
I've been wanting to buy a house in Raleigh.
For yourself or like an investment property?
Investment for Airbnb.
Okay. Smart.
But the house over there is expensive.
Yeah. cheaper more in like I'd say Wendell, Zebulon area.
Uh-huh. Yeah.
If you're familiar with over there.
Yeah, it's in the surrounding areas.
Uh-huh.
Stuff's good. I like Cary, but Cary's also expensive.
Yeah.
That's where old money, right?
Is it old money?
Or new money?
Uh,
A mixture of both.
Cary is more older money.
Yeah, yeah. There was an office that I really fell in love with
Mm-hmm.
to open up a barbershop.
Mm-hmm.
And yeah, it was a little bit. I was trying to get approved and get it ready, but it was
Mm-hmm.
somebody already outbid me.
And Cary.
Mm-hmm.
Okay.
How old are you?
30.
Oh wow.
What about you?
I'm 3 years older than you.
Okay. Wow, you got a lot going on. Very young.
Yeah. Well, you too. You're about to start.
Right. My family will leave me alone. This is my thing.
Yeah, you're 30, but you need to set boundaries now.
Yeah, that's why I'm trying to move 500 miles away. It's even more expensive there.
Really?
Yeah, New Jersey. Tri-state area in general.
Yeah, when you set limits and boundaries in your family, it's a good thing.
Mm-hmm.
Because a lot of times family don't really know what you're going through and will never understand
Yeah,
if
they
they're
don't
not
care.
willing to open up or they're not willing to help themselves.
It just feels bad when you know you're the you're the main help to someone, and you
Mm-hmm.
think about what they're gonna do once you leave. The area they're at.
Yeah.
So you can't base your life around.
Yeah. You gotta move on and you gotta live your life and to the fullest because you only have one, you know?
Yeah.
Like right now, man, I don't know if you follow me on social media, but I picked up a new sport. It's expensive one too.
What's the sport?
Snowboarding.
Snowboard. Oh yeah, definitely expensive.
Yeah. I mean, it's expensive if you're trying to get everything new, but
Mm-hmm.
I've been doing research and I've been getting stuff like used and I've been like I'm not no expert in it, but man, it's like it's a good.
I'd imagine it's similar to like skiing in the
I
family.
never skied before. I heard that ski is easier for beginners
Uh-huh.
than snowboarding.
So it's very expensive.
Yeah, um, but if you become like if you're trying to be an expert skiing, it's a lot harder
Hmm.
afterwards, and it gets easier when you snowboard when you learn how to snowboard.
Mm-hmm.
But it's very therapeutical for me because like I can't I go up there to the mountains
Mm-hmm.
and I do it and I forget about all my problems.
I'd imagine like very western North Carolina.
Mm-hmm.
Mm-hmm.
I'll forget about everything, bro. Forget about
Asheville area.
yeah,
Mm-hmm.
Boone.
Yep, boom, yeah. I
Mm-hmm.
know exactly where you're talking about.
Yeah, Boone is a good area to
Some of the cliffs up there.
Mm-hmm. I go to this place called Beach Mountain.
Mm.
Beautiful.
Is it just you, or you like take your family?
I took my family once. I gotta take my kids there though. I want to put them into a school, into a ski school,
Mm. Oh.
and then I also wanna. I've been going with my friend.
Mm-hmm.
We've been snowboarding and it's good. Like,
Mm-hmm. So you have other people you can enjoy it with.
mm-hmm. Yeah, like Boone, the Blonde Rock is good for family.
Mm-hmm.
The first mountain I went to was Sugar Mountain, which is
Mm-hmm.
like um, that's like a really well known place to ski,
Mm-hmm.
but it's not as friendly. It's not snowboarding friendly.
Mm-hmm.
Whenever I went to Beach Mountain, I was like, "Ooh, this is a lot better." You go all the way up to the top to the mountain, and they have a really nice restaurant and bar.
Mm-hmm.
And the first time I went, I drank a little too much. That it was kind of hard to get down, but it was nice. It was fun.
It sounds like an experience to be had.
Yeah, it's definitely an experience, bro.
Probably feel the elevation differences out there as well.
Yeah. So this weekend's supposed to be pretty bad, like a snowstorm.
Yeah.
And man, I was thinking about going up there.
No, not this weekend.
And yeah, but they say there's gonna be ice, so I don't mess with ice.
Mm-hmm.
I don't mess with that. How did you feel about the first time you heard about SMP? Did you already knew that it was a hair tattoo, or how did you came about?
Um. Well, I had considered getting on the other jack inhibitor that I'm going to be getting on, and then once that came in, considering like if need be, like a transplant once things started filling in. Um, but then I saw SMP, and I just opted for just something that could create a temporary visual density.
Mm-hmm.
Um, because
A
again,
lot of
it's
people get skeptical when they see that it's a hair tattoo,
hmm
and then they start saying, "Oh no," and then they treat it as a tattoo, and I'm like, "No, it's not a tattoo.
hmm
Not a traditional tattoo, but."
you know, just in essence.
Mm-hmm.
But still, like I said,
I
anticipate.
honestly, you're not. Do you know you're not a candidate for transplant, right?
No, at the moment,
Oh, okay.
but I'm saying like once things filled in, if there were any patches still left over,
Hmm.
and that would be
Is
like
there a doctor that told you that
that told me
that
that
you could do a transplant later?
no, I've seen people who've had alopecia get transplants and be successful. So
Really?
yeah, it's one of those things where it's like a misconception about that. But and
Do me a
that
favor. Send me some of that stuff because I want to
uh
read
huh
into it.
yeah,
Because I thought that like.
just anecdotal experiences from people that you read from people from their experiences. Nothing like mainstream published articles about it. Just people's experiences,
No, okay, gotcha.
which I still put
That into consideration
just as much
as research.
yeah, just hearing from the person themselves.
Right, right, right. That's good.
Hmm. most dermatologists actually aren't knowledgeable on
Yeah,
the internal aspects of
hair.
alopecia. They
Hmm.
just know about injecting you with,
Cortisone shots
yeah, the
and.
steroids and
Mhm.
the creams. They don't know about the the inflammations and the
But see,
true internal
the
cause.
thing about it is that with dermatologists, you have to be careful because some dermatologists don't really focus on hair. You know,
Right,
you
they're
have
a skin doctor.
skin, yeah. They just know the bare minimum, like you
Right.
said. But
This is
also
what they're taught, in
in
their school.
university,
So
yeah,
they're not taught to be like the
hair,
holistic, side.
trichologist.
Yeah,
That's what
yeah,
it
right.
is.
Yeah, trichology.
Yeah. If you're dealing with a doctor that's a trichology, a dermatologist that's trichology, that's the one.
Mm-hmm.
But anybody else that's not trichologist but is a dermatologist, I would be concerned.
Yeah.
I would be concerned, bro.
Mm-hmm.
But it looks really good. You already have a C cup. Well, not a C cup, but you already have a hairline profile.
Mm-hmm.
Looks good. I'm happy how it's turning.
Yeah. Whatever to your expertise looks the most realistic, I say. You can go with.
Mm-hmm. Yeah. So have you already interacted with your girlfriend from upstate? Like,
Um,
you still haven't met her in person?
yeah, that's what we're planning on. Like as we speak, I had thought I was going to be going right after this,
Mm-hmm.
but she has some things going on with her daughter, and that we can, because she wants us to establish the connection before introducing me to her daughter and stuff like that, which
Of course.
very understandable and how I would want things anyway. Just
Yeah, because then that's important though.
she had some stuff like prior where after her last breakup, her daughter didn't take it too well, so she just
Oh.
wants to be careful with that.
Yeah, it sucks, man.
Hmm.
Today was funny because I went to buy my board, my snowboarding,
Mm-hmm.
because I would always rent it out from this guy that lives in the next town.
Mm-hmm.
And he's like, man, I just, because he was the one that sold me the board.
Mm-hmm.
He's like, man, you were one of my best clients, customers. I'm definitely gonna miss you.
Wow.
Because I would always, like, every weekend I would hit him up. It's like, hey, I need a board. Hey, I need a board.
Now you got a permanent one.
Yeah, now I got tired of, like, doing that.
Mm-hmm.
Like, I swear, I already spent the same amount that I just paid him, you know?
Yeah, definitely get one that's your own.
Yeah. And I got a good deal on it, too, though.
That's good. And you know it's something that you're gonna be doing moving forward, so it's not a temporary thing.
Yeah. How did you deal with your alopecia during middle school? Like, with your friends and stuff? Did that really affected you?
Yeah, like uh, you just had things to where I just grew up always with a chip on my shoulder, just you know,
People making fun of you?
just yeah, in a roundabout way, because like I've always physically been able to defend myself, so it wasn't, you know, how could I say, disrespect to my face, but just you know, people, you know, in groups, just asking things, just trying to be funny in a roundabout way, but
Mm.
it just
Guess what happened to my daughter? There was a kid in school
mm-hmm,
that goes and said, hi, you have a unibrow.
mm,
And that affected her. She didn't like it at all.
young girl.
And there was a boy that told her that.
Oh wow.
And she had this conversation with my wife. And but the way how we interacted was like, the way how she interacted and handled it was good, because she's like, well, mama, it's one of those things that if they said mean things like that, it's because they're not sure about themselves,
Mm-hmm,
or they're not they feel self-conscious about themselves.
mm-hmm,
So they do that so they can feel better. And
mm-hmm,
if you know that you're pretty, you know that you're beautiful,
mm-hmm,
and you don't feel that way, you shouldn't. It's like, yeah, I know. That's why I didn't say anything mean back to him.
mm-hmm.
And I'm over here like, oh my god, like, my daughter just really said that.
Right.
They
Just
have,
hoping she handles it strongly. You know.
right. If it happens again, obviously we're gonna have to go and talk to the parent or
Yeah,
the
yeah.
teacher. But
I think that's something that your wife could really just talk to her about, and
yeah, like,
girl to girl kind of thing.
like reassurance
Yeah,
too.
right.
And the thing is, like, if I man, I remember when I was a kid, I would go through that, but I would never tell my parents.
Mm-hmm.
I would always suck it in.
Yeah, I just dealt with things as well. Just handle it.
But the fact that she was able to, like, open about it and say it, that's big.
Right.
And it's crazy how it works. Like, and I bet you that he's not going through, doesn't have a really healthy nucleus in his family.
Mm-hmm.
Because it happened to me too. Like I feel like I was that kid at one point when growing up.
Mm-hmm.
Because I didn't have, like, my dad wasn't present all the time. And
Mm-hmm.
I didn't have a mom either. So I just feel like the way how you grew up is important. If you decide to have kids, like, man, be there, bro.
Yeah, present.
Be present, yeah. Because it's a big, big impact in your kid's life if you are. Because that's the way how, he or she will, confront the world, or be able to interact with other people, other kids.
Yeah, when you have what you perceive to be a deficiency in your life, then depending on how you handle things, it could cause you to try to call yourself pinpointing faults, quote unquote, in other people
Mm-hmm.
instead of dealing with yourself.